There is rapid-acting insulin, which tends to be given just before meals in order to control the spike in blood sugar rise that happens after eating. We also have short-acting insulin, and the onset of the action of this type of insulin is usually 30 minutes, and its action will tend to last 5 to 8 hours. The difference between rapid-acting and short-acting insulin is that short-acting insulin, although it's also taken just before meals, is that short-acting insulin usually requires a more precise timing of administration as opposed to rapid acting insulin. There is intermediate acting insulin, which can be used throughout the day or overnight. The duration of action of this type of insulin is anything between 12 to 18 hours. Finally, there is long acting insulin, and the duration of action of this type of insulin is 24 hours. It is purposed to provide a basal coverage throughout the day. So you see, ladies, there are different types of insulin, and if you are started on insulin by your doctor, and usually that should be an endocrinologist, this doctor should sit down with you and explain which type of insulin you should be using and when. And the type of insulin that will be picked for you will be dependent on your blood sugar levels that you would have recorded in your logbook or an app. So remember, ladies, it's not enough to just prick yourself and to get the values. You need to write them down, because it is based on these values that if you are needing to be started on insulin, that doctor will be using those values to decide which insulin is best for you. So I mentioned metformin. Let me tell you a little bit more about this drug. Before I do though, I want to reiterate that for patients with diabetes in pregnancy, that will be type 1 diabetics, ladies with type 2 diabetes whose blood sugar is not well controlled with just metformin, diet and exercise alone, then patients with gestational diabetes, and that is ladies who develop diabetes in pregnancy. For these three groups of diabetes in pregnancy, insulin will always be the first line treatment. So the main way of controlling diabetes in these three groups of patients. But metformin does play a role. For ladies with gestational diabetes or type 2 diabetes that was previously managed with just diet and exercise,